You're listening to The Social Workers on WCDB Albany.
Welcome back to The Social Workers radio talk show on WCDB FM in Albany. My name is Eric Hardman. I'm your co-host here with Alyssa Lotmore. Welcome back, Alyssa.
Hi, Eric. I'm glad to be back with the new show of the semester.
The first show of the semester. It's an exciting time of the semester. Students are arriving, faculty are arriving, and we are ready for a new academic year, right? Mm-hmm. So there's a lot going on. We've got a very busy schedule packed this year for the social workers. Lots of great interviews, lots of great, I would hope, some co-hosts and some increased engagement from students and faculty, members of the community, topics that are important to all of the above, and we're excited about it, right?
We are.
Okay, so let's get right into it. We have an interview today live here in the studio with Victoria Rizzo. Vicki Rizzo is an associate professor at the University at Albany School of Social Welfare. She has dedicated her career to demonstrating the value of social work in healthcare settings through her research, teaching, and workforce development activities. Dr. Rizzo's research examines the impact of social work and interprofessional interventions that include social workers on healthcare utilization, health and behavioral health outcomes for older adults coping with chronic illnesses, elder abuse, and caregiving. She also examines the implications of her work for healthcare policy and for the financing of the provision of social work services to older adults and their caregivers. Dr. Rizzo has extensive experience as a healthcare social worker in the practice realm and has conducted research with colleagues at Kaiser Permanente Healthcare Systems, Rush University Medical Center in Chicago, and the Jewish Association Serving the Aged in New York City. Dr. Rizzo has also published 39 peer-review articles and book chapters to date. She is currently co-editing a textbook which is entitled Gerontological Social Work and the Grand Challenges, focusing on policy and practice. She is a distinguished scholar and fellow of the National Academies of Practice, a fellow of the New York Academy of Medicine, and a John A. Hartford Geriatric Social Work Faculty Scholar. That's quite a bit. Welcome.
Welcome. Thank you so much for being on.
Thanks for having me on.
We're excited to have you here in the studio with us and to talk to you about your work and about your teaching and about what it's like being a social worker. But first of all, welcome to the Social Workers. I believe this is your first time on our show.
Yes, it is. It's great to be here.
Great.
Now, I'm going to jump into the first question. So I do know that in 2020, you'll celebrate your 30th anniversary as a master's degree of social worker. You know, over this period of time, what has been a common thread through your research, practice, and teaching?
This is a great question. So yes, I will. I graduated from the University at Albany School of Social Welfare in 1990, and 30 years flies by. A long time. So
a great alum.
Yes.
Thank you so much.
And so really the common thread in my work is that I have really focused all of my work on how to demonstrate the influence of social work interventions on outcomes such as depression, healthcare utilization, and quality of life, specific to social workers who are working on teams. And the one thing that I have thread through my work has been, in all of my research that I've done, being able to identify and describe the specific activities that social workers do that make a difference on interdisciplinary teams. Like if you look at the literature, there are very few published studies that say the social workers did X, Y, and Z, and this was related to the outcomes in terms of symptoms of depression, quality of life. And so I really, for 30 years, have been trying to do that, mainly with one of my colleagues from the University of Wisconsin, Whitewater, Janine Rowe. And so I've taken all of this research, and my other thread is to really help students understand that practice, research, and policy impact each other. And that my goal as an educator is really to help students see the connection between the three. And so I actually teach macro practice, I teach clinical practice, and I teach policy, which allows me to really integrate these three areas. And so my goal always in policy classes is to tell practice students, my goal is to get them to love policy as much as they love practice by the end of the semester.
Well, so many people, I remember even when I was a student, I first came in and I didn't really understand the connection between, I was like, oh, I'm going to do clinical. Why do I really need to know too much about policy? That's not what I'm going to do. And then once I started practicing, I was realizing that, well, that really does impact in a really significant way the work I'm trying to do clinically. Everything is connected. It all goes hand in hand. So having you there to sort of make it easier for us to see and understand that connection is so important in our profession, especially as a student before you even enter the field, to know that.
Exactly, because policy, of course, influences the kind of interventions and also influences how social workers get paid,
Sure.
which is really important. And then, of course, research says to policymakers and to practitioners, hey, look, there are these great interventions that you should be using. We have evidence that shows that they work with people. So yes, it's very exciting to be able to help students make those connections.
So I wanted to ask you, 30 years is a long time in a given profession, and you have the ability, having had that extensive experience, to really think about how social work might have changed over that time. And one of the things about our show is that we sometimes have an audience who doesn't understand what social work is, and we have people that may be in the community that are external to the social work profession. And that's one of the things that we really view as important about the show, is translating what social work is and how social work might be changing and how the rest of society interprets what social work is. So I wonder if you have any thoughts about how social work has changed since the time you've been in the profession.
That's like a really great question. So when I started the program in 1990, really social workers were seen as therapists, right? Psychotherapists. So learned a great deal about psychotherapy and ego psychology, and social workers were doing a lot of work in host settings, but a lot of counseling work. The shift that I've seen over time, because all of my research is embedded in community organizations. So I'm not like creating an intervention and trying to shop it somewhere. I'm going into the agency and saying, hey, what are you doing that's really interesting? And what would you like to know about your interventions in social work? And so what the shift that I've seen, which is a really kind of exciting shift, is when I was doing work in healthcare in 1990, there weren't very many social workers doing that. And the talk of social determinants of health was mainly in the public health domain. But the shift that I've seen over the years is that everyone is starting to use that language, which has a downside because it's like they've discovered it, and social workers have known that social determinants of health are around since like 1900. But we're seeing increased role. There's this recognition, and my area is in health and aging, recognition that there is really an important role for social workers to play on teams in helping address like the non-medical needs of clients. And this recognition in health and mental health that, look, it's not just the medical or behavioral health interventions that help people, but there are other things in their lives. They live in unsafe environments. They have no transportation. They have no healthcare clinics. And there's this recognition that social workers can help in the behavioral health as well as these other fields.
So maybe can you tell us a little bit about some of the specific interventions that your research has been looking at? You said you go into organizations and find out what are the social work practices that they're interested in learning about or that they're doing but they haven't quite studied the effectiveness of. Tell us some of the interventions that are really exciting to you.
Sure. So the two most recent interventions that I've worked on that are really exciting really do include collaboration between disciplines. So when I was in New York City at the Jewish Association Serving the Aging, I was their founding research director, and they had a lawyer, social work, elder abuse intervention. And they really wanted to study that because they got funding from the City Council and from DFTA, the Department for the Aging. And they kept going to the City Council with anecdotal stories, right, about how the intervention helped this person or that person. So a doctoral student, David Burns, and I actually developed a study with a master's degree student who was also working on that study to look at what is the impact of this interdisciplinary intervention on case resolution, and decreased risk for older adults. And what we found in the study, just to, because we have a limited amount of time, is that older adults who were at risk for elder abuse, if they were seen by the social worker and a lawyer, there was much more probability that there would be decreased risk for future elder abuse when they were discharged from the program. And that really is because the program also co-located, the lawyer was an employee of JASA. So if a client said to the lawyer, oh, I don't want to do these eviction proceedings for my grandson anymore, the social worker could still work with the client to help them get to the point where they would want to make that change. And then he could bring the lawyer right back in. So it was that was my first study where I really looked at this interdisciplinary, interprofessional collaboration. My most recent work is at Rush University Medical Center, and they have an intervention called the Ambulatory Integration of the Medical and Social, the AIMS model, which is embedded in their primary care clinics at Rush and is now being replicated in many community organizations like Jewish Family Services. And what this intervention does is the physicians refer patients to the AIMS model if they have non-medical needs that are impacting their physical condition. So transportation, they need entitlement programs. It has 5 steps. So engagement, engaging the client, then doing a very thorough assessment and care plan development that only has 1 to 2 goals on it. You want it to be doable for the patient and the social worker. Then there's case management that the social worker and the patient and many times family members engage in. And then they attain their goals and they're discharged, but they're told that, look, you can come back if another problem, and it usually does. In our studies, we found that 6-8 months later, some other issue occurs and they come back to the social worker. So what we found, we've done 2 studies. We did a retrospective study, and in that study, we found that people who received AIMS actually had decreased emergency department visits and decreased hospitalizations at 6 months when compared with the general population at Rush University Medical Center. So then we actually did a prospective study with funding from the Commonwealth Fund and looked at the impact. We had a comparison group where there were people in Rush who were not getting the intervention and people who were. And we have published, I think, 6 articles out of this study now. But what we found, which is related to what I said earlier about identifying and describing specific tasks that social workers do, so we found that social workers spend a lot more time with the 150 minutes versus the medical staff, which is 5 to 10 minutes.
Interesting.
And that this time spent really can allow them to address those non-medical needs, right? Because they take more time. And in this study, we were able to document every single phone call, the duration of the phone call, face-to-face visits, time spent with referral sources, so we could look at that. It was documented in the electronic health record. The other thing that we realized is that the electronic health record is a really powerful tool for social workers to document what they do. And if it's documented, then it occurred. And so we could go, and we'd spend a lot of time training the social workers at Rush how to document what they did in the medical record so that then we could collect that data. So we knew exactly what they were doing. And using words like motivational interviewing, problem solving, called to make a referral, all those things are documented in the medical record.
Because it's so sometimes when we think of social work, when we're looking at a medical record, all this stuff happens, but it's kind of like behind the scenes, I should say, and it's not really documented. People just think, people get from here to here, and they don't really see that social worker intervention. So having it documented, not only for research, but also as to show this is how we do have these successful results, or this is why positive results are happening, and people aren't getting lost, and people are getting connected with resources, to have that documentation there to show this is what's occurring. This is what brought us from point A to point D or E.
Right, and so Janine Rowe and I have done 2 systematic reviews of research in aging. And what we found is that many of the articles will say a social worker is involved, but they never say what the social worker did. And then in our interviewing of physicians and staff in the primary care settings, we would say, what does the social worker do? And they would say, well, we don't know what they do, but we know that whenever there's a problem that no one else can handle, we give it to them and somehow it miraculously is taken care of.
It works.
That seems to be a common thing that we hear sometimes. We don't know what the social worker does, but when they're involved, it really helps us out.
But what was so interesting about this study is there was in the electronic health record, there actually was documentation for every step of the AIMS project, and we called that information using a data collection tool that we made. And what we found is that In Ames, in this study, we found that at 6 months, there were decreased symptoms of depression and, importantly, decreased health risk for patients who received Ames. And then we were also able to identify what parts of the social work intervention were significantly associated with that. So we found that for depression, symptoms decreased if there was more patient engagement activity and more assessment and care plan development between the social worker and the client. And then for health risk, we found that people who received more units of assessment care plan and case management tended to have lower health risk. And both of these intuitively make sense, right?
Yeah.
Because if you have someone who's at a high health risk, you identify why, and then you take steps through case management referral to address those issues.
So this seems like work, it seems like research it's critically important for the social work profession, but also for the healthcare industry, for society at large. What's the reception been like to your research findings?
So at Rush University Medical Center, in the study that we did with Commonwealth funding, our primary outcomes were not depression and health risks. They were ED visits, hospitalizations, and re-hospitalizations. We didn't find any significant findings there between the comparison group and the control group, which was disappointing. Mm-hmm. But the head of, the medical director, when Robin Golden, who is the other principal investigator on the study and developer of the intervention with her team, he said, but you're decreasing symptoms of depression and people's health risk is less. This is a wonderful finding, and so now we're going to hire more social workers, which is what we want to have happen.
Right.
So, when Robin started the Department of Aging at Rush, there was like her and 2 social workers. There's now 40 social workers. So the response from Rush has been amazing. There are also replication sites, and Ames.com has all of the information on the Ames model. The other reception is this research has been nationally recognized, so I was invited actually to a public hearing of the National Academies of Science, Engineering, and Medicine. They have a report that's coming out on September 25th that's entitled Integrating Social Needs Care into the Delivery of Healthcare to Improve the Nation's Health. So our studies are included in that report, and also we gave a national webinar to practitioners and to the Consensus Report Study Committee. So that's very exciting. And we've presented the work nationally and internationally in Ireland and England and Belgium, and have gotten really good responses to it.
Congratulations. So if you've just tuned in, you're listening to the Social Workers Radio Talk Show. I'm the co-host Eric Hardiman here with Alyssa Lotmore, and today we have with us an interview. We have with us live in person Vicki Rizzo, Professor Vicki Rizzo from the School of Social Welfare here at the University of Albany, and we've been enjoying the conversation so far. So maybe if you could tell us a little bit about your co-edited textbook that's coming out.
Oh yeah, sure. It's going to be published in September. So
September's a big month for you.
Yes,
a lot
September
of
is a
coming
very
out.
big month. So just to give you a little bit of background, the Academy of Social Work and Social Welfare, the Council on Social Work Education, Society for Social Work and Research, and the National Association of Social Workers launched an initiative, the 12 Grand Challenges of Social Work, and there are 12 global challenges that social work should be addressing in this part of the century. So some of them are closing the health gap, healthy development for all youth. So there are 12 of them. And so when I was the chair of the social work department at Binghamton, I was the chair of the gerontological workforce of the National Association of Deans and Directors. And I, with 3 other members of that committee who are also deans and directors, Sarah Sanders, Stacy Collimer, who is also a University at Albany alum, and Cheryl Waits, we got this idea that the 12 Grand Challenges, people would talk about the 1 or 2 that included aging. We're like, they all include aging. And so we got an idea to write an article about this and realized it really wasn't an article, it was a book. So we met with an editor from Springer Publishing, and the book really had 2 purposes: to support the next generation of gerontological scholars in social work. So all of the chapters are written by assistant professors or very early career associate professors in gerontology, so we can bring along the next generation, much like the Hartford Foundation really brought us along. The second purpose is to educate students about the grand challenges and the importance of the older adult population across all of the grand challenges. So there's a chapter for each grand challenge. There's a summary of the challenge, an overview of the considerations for older adults related to the challenge, case presentation that includes assessment, intervention, and then a future steps for research policy and practice with discussion questions.
I'm really excited. Hopefully that will be in our library too,
Yes.
or some way for us to need to see a copy of this, because it's really exciting, all the work that you do. And one of the reasons I love being on the show is because we do get to find out more about what people are doing and the research that they're doing. So, I mean, you've been my neighbor for the last few years, office neighbor, and I'm just learning a lot of this stuff because I don't always get to know the level of detail of the types of work and research that our faculty doing. And I want to know that. I want the public to know, so we can really see all the ways that our faculty and people in our community and our alums are involved in making a difference in the social work profession and moving our profession forward through this types of research and interventions. So I'm really excited that you were able to come on today and talk a little bit about this. And now I know, so now I can knock on your door and ask you questions about all of this.
Well, I'm glad that you invited me too. It's a great way to start the new academic year, and thank you so much.
Thank you for being on the show. It's exciting, just on behalf of both Alyssa and I, but also at the school, as we welcome new students here to the school. It's exciting to think of those students learning from you in the classroom, getting involved hopefully in your research as well, and really pushing this social work profession into the next generation.
Thanks.
Yeah. So you've been listening to The Social Workers, and we've been interviewing Dr. Vicki Rizzo, Associate Professor at the Albany School of Social Welfare. Thanks so much for being with us, and we will see you next time.
You're listening to The Social Workers on WCDB Albany.